To help you take care of your horses, we present Vet Tips, featuring the veterinarians of Alamo Pintado Equine Medical Center in Los Olivos, California.
My name's Judy. I'm a veterinarian and staff surgeon at Alamo Pintado Equine Clinic, and I'm here to talk to you today about the choices of imaging modalities for the lame horse. So your horse is lame, your veterinarian spent a great deal of time figuring out where the lameness is, and now you're trying to decide what tests should we do to try and figure out why my horse is lame. As always, the most important part of a lameness exam is the clinical exam and nerve blocks to localize where to look. But once you've figured that out, there's a whole host of different tests that can be done to try and figure out what's going on. The most common imaging modality that will be chosen is something like an X-ray or radiograph of the given region. This is really good to detect things like bony problems or arthritis or issues with the bone, but isn't very good for soft tissues. Ultrasound is often chosen because it's very good at imaging the soft tissues, can be done standing, is relatively inexpensive to perform, and is readily available with almost every equine veterinarian in the country. Magnetic resonance imaging is a technology that's been around for quite a while. It's been around in the horse since the late 1990s and has become much more popular throughout the country. There's generally two different types of MRI that are available. A standing low-field MRI, which is often used in feet, fetlocks, and suspensory ligaments. There's high-field MRI, which gives a great imaging characteristics for both soft tissue and bone, and can be used on the head, legs of most horses, but does require general anesthesia. Nuclear scintigraphy or bone scan is often used when you're unable to identify the exact location of a lameness and you're trying to figure out why a horse might be lame and where it might be lame. It's often referred to as a topographical type of examination, trying to figure out the where as much as the why. CAT scan is often used in horses to determine orthopedic conditions that may cause lameness. And there's two main types of CAT scans that are available these days. One is a traditional donut-shaped CAT scan, which often requires general anesthesia, but more recently can be done standing in some horses. And then there's the cone beam type systems, which often appear as robotic systems that swing around horses in a standing position. PET scan has recently come online for horses for orthopedic conditions and is being researched as a potential alternative to other modalities when a diagnosis cannot be made. It's early in its stages of development and is showing great promise for diagnosing lameness in the horse. One thing to remember whenever choosing an imaging modality is sometimes simple things work very well. So the clinical exam can't be overemphasized for diagnosing lameness in the horse, and utilizing your veterinarian's experience and knowledge in determining which test is the best course of action in almost every case. My name's Judy. I'm a veterinarian at Alamo Pintado.